Hi everybody. Today we'll be talking about nipple crack. What exactly nipple crack is, what causes nipple crack, what can be done to prevent it and to cure it. I'm talking confidently about it because I'm somebody who has been through all this pain. So I'll tell you my story and what I did to cure it and how I'm trying to prevent it at present. So it's been about 2 months that I delivered my baby boy, and it was 5 to 6 days post delivery that I had one of my nipple cracked. So it was like scar on the nipple, and I saw some blood on it. It wasn't bleeding continuously, but yeah, I found that it's painful and I could see it. So this was caused because the baby couldn't latch properly, or I was unable to provide the complete areola area region to the baby. So latching is one important thing that we need to learn post delivery, or even if you could go through it, understand the theory behind latching before delivery, it would be very helpful. So this was one reason because of which I had nipple crack. Secondly, if your baby is grown up, as in if your baby is now able to bite your nipple, then it should be taken care of because that can also cause nipple crack. So one of my friend called me up, and this was after 4 5 months of her delivery that she first time experienced nipple crack. So I'm just saying that this could be something that you'll experience in the initial days or later on, or if luckily if you are somebody who is preventing it before anything like that happens, then great. Okay, so in my case, latching was an issue. I was providing the nipple in the mouth of my baby. So that caused the nipple crack because baby was only pulling through the nipple. We should be providing the areola region for the baby to suck. Only then the latching is proper and your nipple is safe. Also, when you are detaching your breast from the baby's mouth, then you should not directly pull it from your baby's mouth. So that will also cause nipple crack. So if your baby is sucking and then you try to pull the breast away from the baby, the mouth of the baby still on the areola region or the nipple region, when you pull it, it will cause crack. Secondly, if your baby is a bit older and is now able to grab anything quickly, that should also be taken care. And if you're excessively breastfeeding, then too it could lead to breastfeed nipple crack. First thing, when you detach your breast from your baby, you should put your pinky finger in his mouth, side from the side. If this is his lips, and he is sucking your nipple from here, then put your pinky finger from the side, slide it, touch the nipple inside his mouth, and bring it out. Okay, so in this way, your nipple will be safe. The child won't bite it or would not grab it. It helps your nipple to be safe. So if at some point if your baby is not leaving the nipple and you have some other work, or suddenly somebody rang the calling bell and you have to go and open the door, you can detach in this way. So that breaks the sucking process. The vacuum which the baby creates, that gets break and it is left out. Okay, and then second thing, you have to learn how to latch your baby properly. It's not on the nipple region, it's the areola that you should provide to the baby to suck. Initially the baby may not be mature enough to understand where to start sucking, so you should press your areola region, put it inside its mouth, and then let the baby suck it. Always remember, let the baby open its mouth widely when you open it, when you provide your breast to the baby. Do not if the baby's mouth is only this much open and you're trying to put the areola region, baby may not be able to latch properly. So let the baby open its mouth widely. The baby could be crying, so when your baby cries, the baby will open his or her mouth completely, and then you can press the areola region and allow the baby to latch over it. Or else, there is one technique which I learned right now. Like, this is a chin area, consider this the chin portion of your baby. Just give it a touch with your finger, and then baby opens its mouth, and then let your breast slide into his mouth. Okay, this is the right way of latching your baby. I'll provide a detailed description about it in another video. Okay, so these are the reasons why nipple crack can occur and how to avoid one way to avoid nipple crack. Now, if you are somebody who has already is already experiencing nipple crack, what you should do is you can apply nip care cream. You can ask your doctor to recommend one if they haven't recommended any as of now. The cream which I was using was named as Nip Care. This is nipple cream. So once you have fed your baby, apply it on the nipple area and the areola area. Let the breast or that area dry properly, And then in the next when the next feeding time comes on that breast, apply oil first. So after applying oil, the cream comes out, and then wipe it with a cloth. That will be the better way to clean your nipple area where cream is already applied. You cannot let the baby latch or breastfeed while the cream is on. Okay, always remember to wipe off the cream before breastfeeding. One of the nurses in the hospital suggested me that when you are applying the cream and then putting on your bra, the cream gets stick to your to the fabric of the bra. So it's always better to cover it with a shield. What I used was a bowl, small tiny bowl. You can place it, or a plastic syrup in your you get those plastic containers where you pour the syrup and feed, right? So you can put that also, so that the cream doesn't get stick here and there. So it's better to cover it up and then let it dry. So this will help the healing process. Secondly, you can use nipple shield. So there are two types of nipple shield. One is a bigger one. So this can be used for the people who have inverted nipple. So when the baby sucks it, the nipple will, you'll get to see the nipple getting elongated through that. And then it will be helpful to feed the baby. You will not realize the pain because the baby is not directly latching over your breast. It's latching on the nipple shield and then sucking. Okay, so nipple shield is something which you can buy. There are silicone nipple shields. There are something which has a plastic mm, or circular region, and then a nipple like structure which is made up of silicone, and then you can feed your baby through nipple shield. Even when you are experiencing nipple crack, you should be feeding your baby. So once you complete feeding your baby, there are two types of milk that comes from your breast. One is fore milk, which is the first milk from your breast. This is more liquidy, watery, but it contains a lot of nutrition. So it's said that fore milk is something that quenches your baby's thirst, whereas hind milk is something that fills its stomach. So fore milk is more watery, but filled with a lot of nutrition, whereas hind milk is something which is very fatty. So why I'm saying this is, you can apply hind milk, the last milk or the second part of the milk which comes out from the breast and feeds the baby. Once the feeding is completed, you can express some milk which is which has got high fat content, the hind milk, and apply it on your nippler area. It also helps in healing the nipple. These are some things that you can follow to avoid nipple crack, to cure your nipple crack, and techniques that you will gradually develop while latching your baby. Hope it's helpful for some of you.